The title of this particular presentation is Educational Needs Identified During Reunification Training. Lena's just set me the task of coming up with two new things. I'm not entirely sure that there are two new things here, but maybe there is. What I've attempted to do is to try to curate some of the things that we at the Family Separation Clinic believe are fundamental to the reunification process, and the kinds of things that we believe that professionals who are working in this field need to understand if they're going to do this work successfully. I don't know what it's like in the States, but certainly in the United Kingdom and Europe, the term parental alienation is becoming more and more common. Many more people are interested in the term, they're interested in the theory, and they are interested in doing the work. We have some concerns about the quality of the understanding, I guess, of some of the people who are coming forward to do this work. People are saying, we do assessments, we do reunification. But actually when we sort of drill down and look at what it is that they're doing, they're really not talking about the kinds of things that perhaps we would understand to be parental alienation. What they're actually doing is using the term to define something that may be a high conflict. So two parents are in conflict, or a child is refusing to see one of their parents temporarily. That's parental alienation, and they say we can sort it out. One of the things that we've been doing at the Family Separation Clinic is working with other people around Europe. We've formed the European Association of Parental Alienation Practitioners. It's a new initiative starting this year. And one of the key aims of that is to begin to, I guess, codify the key elements of working with alienation. I'm beginning to think about how we're going to put together the kinds of training plans that professionals who are interested in doing this work can sign up to do, so that they are competent, so that they're meeting recognised standards. And when I talk about recognised standards, I'm not just talking about everybody working in exactly the same way, but having the underpinning principles agreed, so that people who are doing the work have something to work against, and the families that we're working with, have some idea of what it is that they can expect from people. There's a huge amount of things, and when I tried to put this presentation together, it was very difficult to exclude things. That was the most difficult thing. I think the first thing to say is that working within this field, working within reunification, is not for everybody. And when we're thinking about the training needs of people, I think before we even get to the training, we need to be thinking about what qualities people need. You know, is this actually something that they want to do? It is very, very stressful. We're often at the centre of everybody's projections. We can be working as professionals, but there's a whole system around us. And we're not just the family, but we've got legal people, we've got court assessors, we may have social workers, we may have teachers, and a range of other people who have all got a view on this. And we, as practitioners, become the centre of it. So anybody who wants to do this work has to recognise that. They also have to be prepared to work outside of the standard therapeutic models. And I think this is really important. We have a particular problem in the UK at the moment of groups of people who say that they are working with parental alienation, who claim that you can apply standard therapeutic models, family therapy, systemic therapy, to it, unamended, and that you can work within the ethical guidelines of the regulating bodies. What I should say is that the people who are saying that are also people that have never actually done the work. They've never done reunification work. They're simply asserting these things. And I think it's critical that we recognise that doing this kind of work is fundamentally different to doing any kind of other therapeutic work. It's not the kind of work that you do in an office once a week. It's not the kind of work where you can simply bring a family in and sit them down and work for an hour. This is fundamentally different. And I just picked this the other day. I think Karen used this in the blog. She stole this from me just the other day. The Mr. and Mrs. Good Guy approach, so important in traditional individual and family therapy, has no place in the treatment of PAS families. Only therapists who are comfortable with stringent and authoritarian treatment procedures should be involved in conducting therapy with such families. When we're thinking about the training needs of people who want to work in this field, I think this is critical. I think people need to recognise that they're doing something different. They will be required to compel, and that's something that lots of therapists, it's completely against all of their training. Therapy is either something that people signed up to voluntarily, or it isn't therapy at all. So I think that's critical that we think about that. And I think it's also critical for those of us who work in this field to, I guess, be careful that what we're not trying to do is fit reunification work into our own practice. But what we're actually doing is ensuring that the interventions that we employ meet the realities of the situations. Going back to this idea of overriding the voice of the child. The voice of the child, 12, isn't it? Section 12 of the United Nations Convention of the Rights of the Child. Very important. I think it's critical that we recognise that children are sovereign, that they have their own experiences, and that children's experiences are at the heart of everything that we do. But the problem that we have, certainly in the UK, but I think in other places as well, is that has been, that good intention has been turned into something that means that we have practitioners who simply leave children in charge of what happens to them, which is fundamentally problematic. I won't read this out to you, but I think just the last bit there, that giving children's wishes and feelings paramount weight in determining the outcome of such cases burdens children with a terrible responsibility and impossible task of managing the adult world around them. It is fundamentally role corruption. And what we're dealing with in parental alienation cases is in itself a role corruption very often. What we're looking at is children who have risen up the family hierarchy and now in charge of the world around them. And responding to the voice of the child as though that were the sole determinant of what should happen to children merely reinforces that and leaves children with the burden of carrying the responsibility of what happens to the family. So again, when we're thinking about working in this field and the training needs, we have to work with practitioners, and they've got to be prepared to override that belief. And many, many practitioners find that extraordinarily difficult, to override the training that says children's wishes and feelings, the voice of the child should begin to drive what happens. I think this is something that I think that's kind of important, is that as far as we work, we don't see alienation, parental alienation, alienation reactions in children as predominantly a contact issue. We need to have practitioners who locate this in the mental health sphere rather than in the parental rights sphere. Yes, the child is unable to have a relationship with the parent that they reject. Of course, that's the problem. But that's caused by the dysfunction in the parent that they're aligned to. And that's what we need to be addressing. We need to be looking underneath the presenting issue. And we can almost think of contact as being a kind of a byproduct, if you like, of that dysfunction. So the child starts to refuse on the basis that they're responding to the dysfunction in the parent that they become aligned to. So practitioners need to look beyond the presenting issue and think about the issue of contact, if you like, or visitation, whichever word you feel most comfortable with. We need to think about that as something that's going to alert us to the fact that there is a problem underneath that. And that's what we need to be training our practitioners, future practitioners, to think about. To see the contact refusal as being the sign that there is something fundamentally wrong. I think we also need to be very careful about conceptualizing alienation as being an issue around conflict. Yes, of course, conflict is very often present. But in many cases, that what appears to be conflict between is actually one parent's dysfunctional behaviour and the response of the other parent, who becomes extraordinarily frustrated and or hurt, and a whole range of other emotions in response to that. And so what appears to be a conflict between it is actually not the case. And when we think about that, I was thinking about the 8 signs that Garner curated, which we're all familiar with, and thinking about a child's response to conflict doesn't extend to a rejection of the wider family system and things like that. It doesn't match that. And what we're dealing with really is in most cases a child's unconscious response to a perceived threat to their attachment bonds. In severe cases, we're talking about infantile splitting reactions. We're talking about a child employing psychological mechanisms to protect themselves against an intolerable situation. And anyone who does this work has to believe that the shutting down of those normal attachment responses is a serious problem that has to be addressed. It's a serious mental health issue that can't be left untreated. It's not about contact, it's about the child's mental health well-being. And I was thinking about this, and I went back to source, I went back to Bowlby, and I won't read this out again, but I think it's worth just having a look at it. When we're talking about attachment, I read a report, I was doing a court piece the other day, and I was reading the paperwork, and the social worker had assessed the children with the parent that they'd become aligned to. And it reported that there was a good attachment bond because mum spoke warmly to the children in their presence. That was what was considered to be attachment. If you go back to the source material, if we look at this, what we're talking about is attachment is not something that just kind of happens at a surface level. This is part of the fundamental building blocks of our whole relational world. We learn in the very first months, in the very first years, about relationships. It's a drive, a biological drive, when we look at Bowlby. And if those things are corrupted, that affects the child profoundly for the rest of their life. And again, when I'm thinking about attachment, attachment isn't just how a child is when they're with the parent, it's the child's ability to leave that parent, to go and explore the world around them. Therefore, when we see a child who is drawn towards a parent, that should alert us to the fact that there is a problem with the attachment experience in the child. Just a further one that I thought was really interesting. So Bowlby observed a pattern of insecure attachment he termed compulsive self-reliance, in which a parentified child assumes caregiving responsibilities toward the parent. Bowlby hypothesised that because of their insecurity about the emotional availability of others, some parents turn to their children to meet their own emotional needs. And at the bottom there, the important thing is that that's met at the expense of the child's own developmental needs. So again, this is firmly rooted in the mental health aspect. And that's what we need to be training practitioners to think about. We're looking beneath the surface, we're looking at the child's developmental needs and how they are or are not being met. Okay, so the tasks that must be undertaken. This is kind of the overview, if you like, of the work that we need to be training professionals in, to think about what their role is, what their responsibility is in reunification. Now, what I should say is that I'm aware that the environment in which we work in the UK is different to the US. And of course it's different to some of the other European places that we work in as well. So it's important to factor your own contextual understanding to these things. But essentially what we're talking about is that somebody who wants to do reunification work needs to be trained in how to conduct a forensic examination of the case. And when I say forensic, I mean forensic. I mean they need to be able to dig into it, they need to be go down and across and back up again. They need to be pulling everything apart, all of the information that they've got, so that they can begin to build a picture of what's happening for the children. Once they've done that, they need to be able to inform the court and educate the court, which in itself can be quite a task, particularly if you've got other professionals within that court process who don't understand the problem. Then you've got to prepare the treatment route, finally carry out the work, and then after that's been done, ensure that the follow-up work is completed with the family. We'll break this down a little bit as we go through. But there's a huge amount there for anybody who wants to work in this field. This isn't simply about deciding that you're going to do a bit of therapy with a family and hope that we can bring some change about. That is an incredible amount of work to be able to undertake, and a huge burden of responsibility as well. We use a tool called the transition bridge. This is something that we developed as a way of conceptualizing, a way of describing the tasks that children face as the family separates. And in many ways it can be very, very useful to help practitioners, professionals to begin the process of understanding what's going on for the child. What you are very often doing is, and this is a kind of motto that we have, if you like, or a go-to statement, the route out of an alienation reaction mirrors the route in. So if you can understand the route into it, then you can begin to build a treatment route that's going to lead the child out of that again. So the transition bridge really is thinking about attachment. So if we think about the child in the majority of family situations, the child will have a unique attachment relationship to both mum and to dad, but they'll also have what we might call a unified attachment experience. And the task that faces all children when the family separates is to maintain those individual attachment relationships, but in a fractured world. So what we have is one parent in their world and another parent in a separate world with a huge gap that opens up between. And the child has to find a way to maintain the relationships with both of those parents. And the child is having to do the work of moving between those parents, not just physically, which can be tiring, but much more importantly, they're having to do that work psychologically. So the transition work that they have to do from being with one parent is to break that attachment relationship to them, cross a psychological no man's land where they're not attached to anybody, and then rediscover their attachment to the other parent. Once they've rediscovered that attachment to that parent, then they'll be fine. They'll feel safe, they'll feel secure. But then, to leave that parent, to go back across the transition bridge, they have to break the attachment, cross the no man's land again, and rediscover their attachment to the first parent. It places a huge burden on children. What you typically see with children, even in the families where parents are more or less getting it okay, is that those children may have a period of adjustment, the transition from one psychological state to another, as they rediscover the attachment bond. So a child may come into their house, they may be quiet, they may be sullen, they may stay with their coat on, and then suddenly they'll emerge. And then when they're due to leave again, they'll become disruptive or sullen, any of those things. And what we're actually seeing there is the child's psychological transition from being in attachment relationship to one parent to having to break that, going across and rediscovering it. Now, where parents more or less get things right, the gap between the parents closes. The transition bridge, if you like, the bridge across that gap becomes easier for the child to navigate, and over a period of time it becomes more or less unnoticed by the child. However, where you've got problems with a parent's behaviours, so for example they become very distressed when a parent leaves, they become very angry, they become very anxious, they break down in tears, they shun the child, any of those kinds of behaviours, the threat that the child experiences in terms of their attachment relationship to that parent suddenly comes under threat, and it becomes much more difficult for them to make that crossing. I just want to have a quick word about justified rejection. Barbara Fiddler and Nick Barlow, I'm sure you'll all come across this. I think we need to be training people that they always have to be on the lookout for what we can call justified rejection. Not every case that we deal with is about parental alienation. And we need to keep practitioners safe in their work. We need to make sure that they're not missing things that actually are about the child's justified rejection of a parent. And there's just a few things up there: neglect, cruelty, incapacity, physical harm, emotional and psychological cruelty. Those kinds of things we might begin to talk about as being a justified rejection. Now, the important thing with a justified rejection is we need to be getting practitioners who will work to change that. They'll change the dynamic, because a rejection is a rejection, and the child may still be struggling because of the break in their attachment experience. So practitioners need to be looking out for that, anything that may be described as justified, but also not just then saying, okay, that's fine, we'll just leave the child where they are. The practitioner needs to be thinking about what they can do to begin to restore that relationship. One of the first tasks I think that we need to look at is the severity of an alienation reaction. Not all alienation reactions are the same. They're mild, they're moderate, they're severe. We use this idea of the tipping point. We feel, from our experience of doing this work, that children who are displaying mild to moderate alienation reactions can be helped without the most draconian of interventions. Once a child has moved beyond that tipping point to the most severe, then very often the most draconian measures need to be brought in to begin to reshape the family dynamic. I've just listed some there of the kinds of behaviours that practitioners need to be trained to think about. They need to be able to break this down. Not every alienation reaction looks the same. And if we treat all alienation reactions in children as the same, then we will fail the children, because we need to put in place the treatment routes, the interventions that will match the child's unique experience. So these are the kinds of things that we need to be training people to be looking out for, so that they begin to build up a picture of what's going on, the unique picture of this individual family. Then they need to be thinking about the categorization. Again, I'm going to use Fiddler and Barlow. Hybrid alienation, pure alienation, and pure alienation broken down into pure and unconscious and pure unconscious. Has everybody come across this model before? Yeah, okay. So in a hybrid alienation, we might be looking for the level of alienating behaviour in the aligned parent, the contribution that the rejected parent has made to the alienation, the age and sex of the child, and the length of time the alienation reaction has been in place. It's critical that practitioners are trained in beginning to pull this apart. And I think part of this is we can look at that idea of conflict again. What appears to be conflict may actually be something very different to conflict. This may be a case that's been in the court for 4 years, and a parent has become so frustrated that they appear to be the parent who's causing the problem. And very often we kind of, I suppose we see practitioners talking about hybrid alienation as though that means that it's both parents are as bad as each other. It's just a cross-projection of blame, and therefore both parents are to blame. We need to therefore sort them both out. Actually, a hybrid alienation can be something, I think, much more nuanced than that. It's something that I'd like to do some more work on. We talk about active and passive hybrid alienation. So I was thinking about the difference between, for example, two parents who are perpetually at war. One parent is saying, well, she's not having any of my money. That's all she's in it for. She's for the money. I'm not going to give her all that money. And the other parent is saying, well, my role of bringing up the children wasn't respected, and therefore, unless he begins to respect that, then he's going to have to. That's something where we might call it an active response in the hybrid category. That's two parents who are rigid in their position, rigid in their thinking. They're both contributing quite actively to the dynamic that may be causing the child a difficulty in being able to make that crossing of the transition bridge. There are, on the other hand, passive responses. So one parent is incredibly dominant, and the other parent is passive and incapable in the face of that of demonstrating to the child that it's okay for the child to cross that bridge. And there are grades in between that. I remember a particular case I was working with where I had absolutely no doubt that the father was acting in some very unpleasant and difficult ways that was causing the child to respond in a particular way. However, I also know that this child, who was 14, I think when we first started, was constantly trying to reach out to her mum. I want photographs from when we were children, so demands of mum. But mum wasn't able to respond to these in the way. She was so hurt by the fact that her daughter had rejected her, she just kept telling her daughter, I gave up a career to have you. How can you do these things to me? So when we're talking about hybrid alienation, we need practitioners to be trained to pull those things apart and look at the specific dynamics and not take things at face value, but to mine underneath and pull them apart. When we're looking at pure alienation, our practitioners need to be trained to look out for other things. They need to be looking for signs of severe role corruption, increasing allegations, making children believe that they've been abused, sharing inappropriate information, creating anxiety in a child, using emotional shunning. Of course, these lists aren't exhaustive. These are just examples of the kinds of things that we need practitioners to be trained to be looking for. And again, we need to be looking for these mental health issues. So this was something that I picked out, which I thought was particularly revealing. Parents who were alienated were also those who had poor boundaries and engaged in role reversal with their children. They had difficulty distinguishing from their own feelings from those of their child. And the child often becomes the parent's confidant, comforting and admonishing other family members, thus assuming an inappropriate executive or parenting role in the family. Role corruption is one of the key features that practitioners need to be trained to look out for. Very often, role corruption is a very difficult thing to spot. What we actually see is a parent who seems very comforting, very warm towards the children, very close with their children. It's only when you begin to test that and drill down a little bit that you can see that actually it's a dysfunctional warmth, it's a dysfunctional closeness. The closeness is about the child attending to the parent's needs rather than the parent attending to the child's needs. So we need practitioners who are trained to be able to look under the microscope and to be able to spot the underlying issues here. And we also need practitioners who are trained to look at power and control dynamics. Power and control is very often conceptualized within the kind of traditional domestic abuse realm. So we're thinking about the Duluth model. We're looking very often at power and control as being something that men have over women. And of course men do sometimes have that power over women, but equally women have that power over men. And it's not about kind of sociological issues. You know, this is not about politics, this is actually about mental health. And what we have attempted to do with this model is to look at a psychosocial model of power and control that looks at the unresolved trauma in a parent's life, that begins to look for personality disorders, poor interpersonal skills, inability to manage rage, abandonment issues and a lack of empathic skills. These are learned behaviours that are very often passed down through the family line and only emerge at particular points within the family life. Sometimes they may be present all the time, but at other times these big things begin to emerge at the point of separation, the point of drama within the family narrative. So it's important that we train practitioners to begin to look again underneath these power and control issues. What's going on? How long have they been there? Who holds the power in the relationship? Who holds the power over the children? Have there been coalitions built before the family separation? What were those family dynamics? And I think this idea of transgenerational transmission of controlling behaviour is a very important one. We need all of the time to have practitioners who are not just working in the here and now, that are not just working in the horizontal, but are also working in the vertical. We need to be looking up the family history. So psychogenealogical, I can never say that word, help me out, please. Yeah, looking up family trees, let's stick with that, is crucially important. What we see are patterns repeated all the way down the family line, and they can give us huge amounts of information. We need practitioners who feel confident in going back and being able to interpret those things that have come down the family history and have re-emerged in the family in the here and now. It's absolutely critical. And power and control is one of the key things that they may be looking for there. I think it's absolutely critical that we train practitioners to think about the assessment process as not being a single event. This isn't about spending an hour, 2 hours with a parent interviewing them and then we know everything that we know. It's not about just sitting with the children and asking them what's going on and then deciding that we know what's happening. We have to train professionals who want to work in this field to think about the truth emerging through process rather than an event. This is a model that we kind of developed to try and illustrate that. So we've got the timeline starting at the top and coming down. We need professionals who, of course, have to start with a kind of a hypothesis. They have to have a starting place. Very often that's from reading the previous paperwork, it's reading the court documents, it's reading the reports from social workers or parental assessors. They start with an idea of what's going on, but that should be very broad. At this point, we should not be deciding that we know what the problem is in the family, because it's very rare that we do. We may have a good inkling, but we don't actually know what's going on. And the way that you begin to test this is the way that we begin to refine our understanding of what's going on is by testing. We have to require parents to do things, because when we require them to do things, then they begin to show their behaviours, the true behaviours. Parents who are left to do therapy where no pressure is applied will simply be nice, they'll be compliant, there's no problem. You have to get people to do things that they don't want to do. So you put a test in and you see what happens. That test may be, it may be that the parent brings the children to see you. That's the first thing you do. Will they do that or won't they do that? Once you know whether they will or they won't, you have some more information. You're beginning to narrow that down. So if the parent looks like an extraordinarily alienating behaviour, their behaviours look absolutely terrible, but they bring the children in willingly, maybe that gives you some information that this parent may not be as bad as the court papers suggest that they are. But then again, we have to test that then from the other side. We have to be going backwards and forwards, testing and testing and testing. And I notice somebody's doing a presentation this afternoon which talks about biases. I think one of the things is about biases. Thank you, Lena. So we have to train people, practitioners, to recognise that they will have their own biases, that they will test the things that they want to test that will confirm for them their original hypothesis, or that things that make them feel comfortable, or because a parent's not being very nice to them, that will begin to change things. So what we're looking at doing is narrowing it down, narrowing it down, narrowing it down until we get to a place where we know exactly what's going on to the best of our abilities, and then we can think about employing a treatment route. Treatment routes, hybrid cases. Generally what we're talking about here is a mix of therapeutic intervention, parenting coordination, but within a framework of strong court management. Okay? The framework that the court management provides is absolutely fundamental, because a practitioner who doesn't have the authority of the court is unable to do anything with that family. In pure cases, we're looking at a transfer of residence, either direct from one parent to another or using stepping stone interventions such as foster care or into the care of another family member, so kinship care. Treatment must match the categorisation. If we get that wrong, if we assume that a hybrid case is a pure case or a pure case is a hybrid case, we get it wrong, then we're doing a disservice to the child. And practitioners need to be confident. They need to be able to explain to everybody, including the court, why they've come up with the particular treatment route that they have. Transfer of residence isn't enough on its own. We need to support the previously rejected parent. What is it in their background that allowed the alienation reaction to happen in the first place? What are their strengths? What are their weaknesses? How much have they been hurt by what's happened so that they're not able to provide the secure platform for the child to be able to come back to? We need to be also continuing, we need to be training people to evaluate and support the previously aligned parent to see what they are capable of doing. What capacity has that parent got to acknowledge what they did and change their behaviours? Because what we don't want to be doing is simply switching the problem from one location to another location. We'll look at trying to restore the child's balance, their capacity to be able to see in grey, in shades of grey, rather than black and white. And we also need to be thinking about supporting the child to adjust. Yes, children will come out of alienation reaction, but they also need support to reintegrate their experience of the world. Still got a few more minutes, Lena? 5 minutes for questions. Okay, so we can do that. Okay, so principles of reunification work in pure cases. It's important to tell the child of the court's decision. It has to be presented to the child as the absolute reality of what's happening. We don't ask the child whether it's okay. We know that the child isn't going to like it. We just say it's a fact. It is going to happen. You can't do anything about it, and I can't do anything about it because the judge has said that this is how it's going to be. Have to carry out the decision of the court using all available means, which can involve using the police, it can involve using social workers. If you talk to Karen about some of the cases that she's working on and worked on, it's a tough business, and we have to be able to train practitioners to be able to deal with this. It's not easy work at all. These children will physically harm you. You will be attacked psychologically. Thinking about it, it goes against, am I doing the right thing? Have I got this wrong? Will this child be okay? So it's not easy work. You need to hold the expectation that the child will reunite with the parent. And convey to the child the decision that this will happen for long enough for the split child's mind to repair. Absolutely fundamental. The task for a practitioner working in the reunification field is to hold the child splitting for long enough for the suppressed attachment in the child to re-emerge. So let's go back to attachment. Attachment isn't something that kind of flips about, it's here or it's not here. Attachment is a fundamental relational response. It is there. Children can't lose it, but they can suppress it. And the task for somebody working with reunification is to hold that split, to hold the dynamic strongly enough and long enough for the child's suppressed attachment experience to rise back up into their conscious mind. And once it's there, once the child's able to hold that, then you have got a reunification. The voice of the child should always be treated with caution, listen to the words, but respond to the child's actions. It's okay for a child to say, no, I'm not doing it, I won't do it, it's not going to happen, as long as they do it. You just let it happen. Sometimes the child has to say that, because that's the only way they can do it. It's part of that process of doing it. You've got to watch out for continued allegations. I'm beginning to think about this in terms of, we worked with two children, and they were fine, they were absolutely fine, and then all of a sudden they would, an allegation would reoccur. They'd say, well actually, she did do this. And I think there's probably three different things there. One is that the alienation reaction hasn't fully lifted. Children will ping-pong, they'll go backwards and forwards for a period of time. Secondly, it may be that the child has simply got into the habit of saying these things, and it kind of just sort of blurts out. But I think that the other thing that's really important, and I think it's something that practitioners need to know, we need to teach them this, that actually what can be going on for the child is that they're testing the reality of the new landscape. Is this going to remain the way it appears now, or is it going to flip back and I will be back with the parent that I once feared? So we have to train practitioners to hold firm, to hold steady, to believe the theoretical things that they know, long enough to allow this to re-emerge. Re-emergence for suppressed attachment may happen quickly or it may take longer. Being patient and holding that tension for long enough for the repressed attachment to emerge, absolutely critical. And it's also important to train people to understand that it's not harmful to the child to persist in ensuring that the direction of the court is carried out. The work is counterintuitive. Your whole body will be saying, don't do it, don't do it, don't do it. And we have to train practitioners to hold it strong enough so that the child's attachment experience can re-emerge. I've had to rattle through those last slides fairly quickly, but I hope I've just about managed that, Lena. And I'm happy to take any questions that anybody's got for 5 minutes.
I think